So now we're going to talk about work practice, administrative, and engineering controls. Work practice controls reduce the likelihood of exposure by altering the way in which a task is performed. Administrative controls include following all training, legal requirements, policies, and procedures related to infection control at your facility, while engineering controls isolate or remove the bloodborne pathogen hazards from the workplace. These include sharps disposal containers, self-sheathing needles, and safer medical devices. Engineering controls shall be examined and maintained or replaced on a regular schedule to make sure they're effective. Now let's cover some examples of work practice, administrative, and engineering controls. Make sure you don't eat, drink, smoke, apply cosmetics, handle contact lenses, or anything where there's a possibility of exposure to bloodborne pathogens. When emptying trash containers, don't use your hands to compress the trash into the bag. Instead, lift and carry the trash bag away from your body. All equipment and environmental and working surfaces need to be cleaned and decontaminated after any kind of contact with blood, body fluids, or any other potentially infectious materials. And if you're dealing with contaminated needles and other contaminated sharps, they shall not be bent, recapped, or removed. Needles and sharps need to be immediately or as soon as possible after use be placed in some kind of appropriate sharps container until they're properly reprocessed. Warning labels should be affixed to refrigerators and freezers containing blood or other potentially infectious material, and containers of regulated waste and other containers used to store, transport, or ship blood or other potentially infectious materials. These labels should be fluorescent orange or red, or predominantly so, with lettering and symbols in a contrasting color. Use personal protective equipment. PPE must be provided by your employer at no cost to the employee. Examples include gloves. Make sure you use them when the potential exists of touching blood, body fluids, or contaminated items. CPR shields and eye protection. Use these when patient care is likely to generate splashes or secretions of blood or body fluids. Gowns. Use these when the potential exists of contact with blood or body fluids on clothing or exposed skin. Masks and respirators. We use these to protect ourselves from potentially airborne infectious diseases. Know where your personal protective equipment is at your workplace, and know what PPE is available and how to use it. Make sure first aid kits and emergency supplies include disposable gloves and CPR face shields or rescue masks. If laundering items, such as reusable gowns or scrubs, rather than disposing of them, follow your facility's specific procedures for handling laundry. General laundry procedures include wearing personal protective equipment whenever you're handling it, keeping contaminated laundry separate from other non-contaminated laundry, bag potentially contaminated laundry where it's used, use leak-proof bags for wet laundry or containers, and transport it in a properly labeled or marked bag or container, especially when shipping contaminated laundry to an off-site facility.